When does patient autonomy conflict with fidelity? Imagine you're at a crossroads where what a patient wants might clash with what their doctor believes is best. That's where the principles of patient autonomy and fidelity can sometimes come into tension. Patient autonomy means patients have the right to make their own health decisions after being fully informed. It's about respecting their self-determination and personal values. Fidelity, on the other hand, is about the healthcare provider's duty to be loyal, honest, and faithful to their commitments. It's about building trust and acting with integrity. Conflicts happen when a patient refuses a treatment that could save or significantly improve their life. For example, if a doctor recommends a life-saving blood transfusion, but the patient refuses due to personal or religious beliefs, respecting their decision might seem to go against the provider's duty to promote health and prevent harm. This is a classic clash between respecting autonomy and maintaining fidelity. Another common situation is when a patient makes choices that could cause them harm. The healthcare provider's obligation to do good for the patient, known as beneficence, might push them to override the patient's wishes to prevent serious injury or death. But doing so could violate the patient's right to decide for themselves. There are also cases where patients lack decision-making capacity, like in cases of severe mental illness or cognitive decline. Here, providers might feel compelled to override patient choices to protect their well-being. But this raises questions about whether overriding autonomy aligns with fidelity, which calls for honesty and loyalty to the patient's best interests. Resolving these conflicts involves open, honest conversations. Healthcare providers need to explain the risks and benefits clearly, listen carefully to the patient's values, and seek a shared decision. Sometimes, ethical committees or guidelines help find a middle ground. The goal is to honor the patient's right to choose while staying true to the provider's duty to act with integrity. In essence, patient autonomy conflicts with fidelity when a patient's choices challenge the healthcare provider's obligation to act loyally and in the patient's best interest. Navigating this requires balancing respect for the patient's independence with the professional responsibility to provide safe, honest, and compassionate care.